suppose that comes down to positions as well, doesn't it? In terms of which kind of positions you feel that you can access different parts of your body more readily in, particularly if you've had a cord injury. You may have parts of your limbs that don't work in the same way, so positioning becomes crucial. So I suppose, Michelle, is there any tips that you have on certain positions that would be useful?
Obviously it depends on level of injury, but often it's getting into a position. So I've been talking to some ladies this week, and they found that getting into a position where she can actually get on her knees, but to get into that position, her partner had to help her. So that was sort of, she wanted to masturbate, but she was really struggling with getting on her knees. So getting on her knees was really important, and being able to, sometimes it's the bed, so the bed being stable, or the place where someone is being stable, knowing how to do it. So maybe a physio has talked to people before about how to get into that because their limbs don't work the same, or they spasm, and maybe using those spasms as well, because using the spasms can be fantastic for people. Or having the bed that's right. So I often talk to people about having a bed head that they can actually get hold of, rather than solid bed head, and not having sort of mattresses that you sink into. So positioning is massively important, but for everybody, as it is with everybody, it's very different. You find your own ways, don't you?
And Michelle, I often suggest to people, if they're trying to find new positions, it's to try those positions when they've got the clothes on first. So when they're in their loungewear or their underwear, to see if they can physically get in those positions first without the added pressure of feeling that they've got to be sexual when they first try it. So they're almost, it's a bit like Twister for adults.
That's brilliant. Absolutely. Yeah. That makes so much sense.
Makes sense, yeah.